Hello and welcome to Sensei podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello everyone and welcome to Sensei podcast. It is my great pleasure to introduce our guest today, Dr. Pratik Sandesara from Emory University, a complex and CTO PCI operator, great friend. Pratik, thank you so much for joining the podcast today.
Manos, thanks so much. It's an honor and a privilege to be here and appreciate the invitation.
Well, it's a great pleasure. And, I remember, meeting you from the early days during the pandemic, I think, when I was visiting Emory, and it was crazy times, but clearly you've done a phenomenal job getting through the field and making a lot of contributions there. But maybe I always like to start from the beginning. Tell us, how did you start going into medicine, into cardiology, intervention, CTO?
Yeah. So, my dad's a physician. He's an internist and geriatrician, and kind of grown up watching him practice. And that's what led me to go into medicine in the first place. And just fell in love with cardiology during med school with the rotations, with the procedures and critical care and the variety of different aspects of patient care in cardiology. And, I came to Emory, so did my residency here, my general cardiology fellowship, and I was interviewing for actually structural fellowship, during my interventional year, and Bill Nicholson every day. I was fortunate that he joined Emory right when I started, I was finishing up my general cardiology fellowship. I was on my cath rotation. Bill and Wassam Jabber were scrubbed into a case, and they had 3 interventional fellows standing behind them watching a CTO case, and me and my diagnostic co-fellows were sitting in the control room. Had no clue what was going on during the case, but it was just really interesting to watch, and then read up about CTO PCI after, and then still was committed to doing structural, and then during the interventional year, got to really work with Bill and Wassam and participate in some of these complex procedures. And Bill started the CHIP CTO fellowship the year that I was the interventional fellow. So I think the stars kind of aligned, and it worked out with the interests and the opportunity, and so it was really kind of the right timing, so to speak.
Well, it's always good to be in the right place at the right time, and you're absolutely right. And there's nothing best than waiting a master operator, I guess, work through complexity and learn from them.
Absolutely.
Now, as you say, structural was and still is one of the hardest areas, right? Rapidly growing, new devices, and it's always a temptation. And actually, many people are saying, why not do both CTO and structural? So, what is your thought? I mean, I know you were interesting structural at this time. Now you find full satisfaction in CTO. You're planning to double in both, or?
Yeah, so that's a great question, and I think exactly as you said, there's so many new devices, techniques, procedures within structural, and also within the complex coronary space. I mean, the field has grown exponentially in terms of our techniques, procedures, devices, new devices coming out. So I think it's hard to be a master of everything. And for me, I think that was the decision point was, to be really good at one thing and be a leader in that space. And, I think I'm very busy as a CTO, complex coronary operator, and I really enjoy it. And I think we have every case is different. So I think every day is different and interesting. And I think it's really hard to, at least personally for me, I think it would be really hard to be really good at everything structural and complex coronary. And I think for me, I want to do the best for my patients and really want to focus on one aspect. And I fell in love with CTO, PCI, complex coronary work. And so I think I've just kind of steered myself towards a one path and try to be a master at it.
Wonderful. So Pratik, in terms of the complexity, I mean, obviously you guys do amazing work there, very complex case, and everything comes from different places with previous failures. Do you get stressed out when you deal with some of those very complex, risky cases? Do you feel stressed? Do you feel um, fear? Do you feel anxiety? How do you feel when you tackle those cases?
Absolutely. I think I'm still learning and getting better each day. But I think a few things that help with that. One, we have just amazing mentors here with Wissam Jabber, Bill Nicholson. So I review all the films ahead of time. We have a complex PCI review that we do every week. We go over all the complex cases as a group, and so you really get a lot of thoughts and insights from some really experienced operators, which helps. I think planning is very important and key when approaching these cases, and a lot of times they're elective. So I think you have the time to really think about it and plan out every aspect of the case, which is really helpful to get a second set of eyes. And then, fortunately for me, I mean, if it's a really, really complex case, Bill and Wassam are one call away. So it's really nice to have senior operators that are available to help either just be around or scrub complex cases with you from the beginning, or if there's a challenge or you're troubleshooting and you get stuck, they're available to help. So however I ask for help, I mean, I think they're available. So I think that safety net is there, and which makes it a little bit more comforting and in taking on these complex cases.
No, absolutely. I think just everyone, I think, including myself and many other experienced operators, I mean, you always have the phone call, the cell of some of the people, and if you get in trouble, always good to get for a second opinion. Sometimes they can help you a lot. And you said about the preparation, which is critical, as you said about getting a good plan in place. Um, how do you, and I know you get a lot of exposure to new devices as well. How do you incorporate those new devices? And I know you were part of new devices, new reentry devices, etc. How do you work with these new devices? How do you incorporate them into your day-to-day workflow?
Yeah, that's a great question, and really, I think one of the things is this CTO community is such a small, tight knit group. You know, people are like a phone call away instead. So I'll call Kevin Cross or Tony DiMartini or Jay Cotry. They're very very available, and so you can get one is to ask their experience if it's a new device and see what their tips and tricks are, and two, our industry partnership is so good within this community. I think it's very helpful to have the industry colleagues with us in the cases when we first start off with the new device and incorporate them into practice. But I think it comes down to also case selection. So getting advice from senior colleagues about whether a new device would be appropriate for a certain type of anatomy in the case. So it all goes back to I think thinking about it and planning ahead of time, and if you're planning to use a new device or new technology. So I think to obviously number one thing is to do it in a safe and effective way, and so I think planning really helps ahead with that, looking at the anatomy and figuring out how you're going to use the device, and then getting thoughts from other operators who may have potentially used the device and get their tips and tricks.
Wonderful. And tell us about the device that I think you published on it as well, right? That how was the device and how do you get involved in this? How do you learn working with this device?
Yeah, so very fortunate to be able to work with John Simpson and Bill and Greg Robertson on an OCT guided reentry device. It's called Acolyte. I was fortunate to go down and do some first in man cases, CTO cases with the device. Had a great experience, and we're about to start an ID trial here at Emory with the device in the next few months, which would be really exciting. So, I think learning, that whole process was so informative. We work with the engineers from the team. After each case, they would ask for feedback, and they would go back to the drawing board and see what they can do to modify and make a few tweaks with the device, and working with them, getting their thought process and how they're thinking about a device or a product from an engineering perspective was very helpful, and all it's an important partnership, I think, with any new device development. So that was a very good experience to be involved with that early on in my career.
Perfect. Yeah, congrats. And again, very You have a very nurturing environment, as you say, but it's always an eye-opening to see how the innovation works and how you do small iterations from one version of the device to the next until you get to something that is really, really good. Now, when it comes to radiation, I know that you have a very strong culture of radiation safety at Emory, and you're using the Rampart devices. So, how concerned are you about this, and what do you do for your day to day?
So, lately there's been a very enhanced emphasis on radiation safety and orthopedic issues within our community, and it was eye opening to hear some of the stories with Dr. Kariakis and with all the orthopedic issues that he's had, and so we use our Rampart system. We have it at each of our three main sites for all complex procedures, especially CTO PCI. Focus on techniques to reduce radiation collimation and just kind of best practices for minimizing radiation exposure. I think there's been an increasing focus and emphasis on that, and it's been really eye opening to see and hear some of the stories from our more senior colleagues about their experiences over time, and I think there's so many different options available now at Agnes, Rampart. I think this has to be something that has to be incorporated as part of the cath lab and the workflow for physicians going forward. There's no reason or no excuse. We have very good data on the attenuation that we get with these devices from a radiation standpoint. So I think it's very, very important, especially for folks that want to have a long career in this field, doing these long, challenging, complex cases.
Yeah, no, completely agree with you. It was actually a CRT that there was a lot of discussion on the panels about the live cases not having any collimation and how one loses an opportunity over there. So it's small things, and it's incrementally helps with each other. And even if you use Rampart, I guess that protects you, but the patient is still is at risk. So the better we do there, the better for the patient and for everyone else.
I think, definitely something that maybe needs more emphasis as part of our training programs as well, for interventional fellowship as well as complex coronary fellowship. And I think it's not emphasized enough, around the country, probably on best practices for minimizing radiation exposure. So I think that's one area that would be really nice to focus on. With some of these courses, meeting CRT, CTO plus, and it's nice to see more and more focus on that.
Yeah, no, absolutely. And as you say, if you see the films, quite often the hands of the operators are in the field taking access and all things like that. So definitely room for improvement all the way there. Now, when it comes to the cases that go south, when things don't work out the way you plan, you have a complication, failures, how do you manage with that?
It's very, very challenging to, in the beginning. I mean, while you're there, you're really working on stabilizing the patient or dealing with the complication. But I think the hardest part of a complication is after you're done with the acute period, and it's very hard to not think about it for the rest of the week or the month. It's depending on the outcome, and it's something that I think for me, I'm still learning how to deal with it. And I think one thing that helps is to share and talk with colleagues and senior mentors about the case, and the whole process of so to speak debriefing is very helpful. And we have a workflow here where we do a debrief with our cath lab team and staff with any serious complication or event, which helps the team get better as well, and personally as an operator helps me get better, and helps me deal with the complications a little bit as well, to have a discussion as a group about what could have done differently, what we could do better, and then having senior colleagues and mentors to help go over the films and the whole with the goal of minimizing another similar complication in the future.
Perfect. And again, as you say, it's always tough, but making the most out of it is the best way forward. Now, how about teaching? I know that you teach a lot of fellows. You have the CTO fellowship, you have regular interventional fellows, a very large and busy program. So, what excites you when you see one of the upcoming fellows?
Initially I was dreading it as a new attending, because one, you're still trying to develop your technical skills, and now you add a fellow to the mix, and it takes a few cases under your belt to get comfortable with having to troubleshoot and try to bail yourself out, so to speak, of some complications or whatever. So I think it was challenging in the beginning to deal with the appropriate amount of autonomy to give and when to take over, and that's gotten better with more experience, I think. But the most exciting part of working with fellows is when they come in the morning, you're reviewing the cases. They have a plan written out. They're like, this is how I want to do the case. It may be different from what you want to do, there's more than one way to do a case, and so it's really the most exciting part of this is to just see them over the year, as the year progresses, see how their thought process has developed in terms of approaching cases and lesions, and how they giving them the autonomy to really think about, rather than just going in there and telling them, all right, here's a 2.0 balloon, here's a 2.5 balloon, let's say, letting them think through the cases. It's really nice to watch them develop as they interpret intravascular imaging as the year goes on and get very comfortable with it. And so I think it's very nice. Also, when you're in there, a lot of times you're talking out loud, so they're understanding your thought process, and it not only helps the fellows but also your team, your scrub techs. And so that's been a very nice part of having the fellows. So they're always asking questions, and so the whole team is engaged. That's in the room, your nursing staff, your tech. So it's really exciting, and we have the Chip Shot Fellows course that we host every year. We have the fellows come, all the Chip fellows come to Emory, and it's probably one of the most best courses that we've had from an interaction standpoint. They're always full of questions, and it's so interactive. So it's very good for the guest operators, for myself, and um, so I think it's really wonderful to see the progression from day one to end of fellowship, and when they're ready to go out and practice. And it's really nice to see that growth in independent thinking and approach to cases.
No, absolutely. And I think, you also, your patience and, as you say, willingness to let them learn also helps a lot, both sides, and grow. And then um, how do you tell, or can you tell if someone is going to be a good operator, general operator, city operator? Is it something you can tell, or is it something that doesn't show up until later in the year?
I think, that Bill and I talk about this all the time, when we interview for potential spots for Chip Fellows. And I think with enough volume and experience, if the fellow is ready to put in the effort, you can make someone a really good operator. If it's someone that takes the initiative to think about the cases ahead of time, to review the cases after, that's willing to put in the work, I think you can really, um, it, make someone a really good operator. It's hard to tell ahead of time. I mean, someone can have the best hands, but even then, a lot of this is mental. It's not just technical. So I think, with and the only way you can overcome that is experience, and putting in the effort and the hard work. So I think if you have someone that's hardworking and wants to learn and wants to put in the effort, and goes above and beyond, I think that you can make them an excellent operator, despite, even if they don't have the best technical skills to start with.
Perfect. So it's more about the process more than the inherent, the innate
Yeah.
talent,
Yeah.
so to speak. And I know that you do a lot of live cases for various meetings. What do you think of live cases as a means for education, both locally and nationally and internationally?
I think that's probably one of the best formats to learn, rather than listening to someone do a talk. I think watching live cases is probably the most helpful way. At least for me in my learning, it was very very helpful. And also you expand and you learn how other operators at other institutions are doing cases. I think especially if you're at one institution like I've been, for most of my training and now on faculty, it's very hard to know what other operators are how they're approaching cases, or how what kind of equipment they're using and why they're using certain equipment over others. And so I think the live cases are a very good avenue to broaden your practice and practice patterns and approach to cases. So the other things that have helped, your YouTube channel. When I was interventional fellow, I would, before we had a bifurcation left main case, I would go, watch a video on that. And so I think that helps more than just reading in a book or looking at diagrams. And so I think the whole case based learning is very, very important and really helpful.
No, absolutely. And as you say, I think every major meeting now has live cases, and they can be extremely, extremely useful. Now, you do the uh, heavy clinical work, you do the teaching the fellows, you have a lot of research going on, your devices coming up, so a lot of things. So, how do you keep up with all of this?
Yeah, so far it's been okay. My wife very supportive. Yeah, I think that's very important, is to have supportive, friends and family, and also have an interest outside of work that kind of, when you're not thinking about work. And so, for me, that's, either going for walks or runs and spending time with friends and family. Even if it's one night a week, you do something where you completely unplug from work. I think that's been really helpful. And having, you know, you really need a group of people around you that are all have similar interests and work ethic, that'll really help you, grow and succeed as a group. So, we have some really good junior, a lot of my colleagues trained with me, the Dr. John Lisco, Dr. Shikalatse. We all have similar interests. We all want to work hard, our interest in research, growing our clinical practice. So, you do it together, and I think that's a lot easier than going at it by yourself and doing it alone. And having that interest outside of work, when you can unplug, is really helpful.
Yeah, and that's great. There's a phenomenal network, both of peers and family as well. How about exercise? Do you do? So you run, you walk. What do you do for keeping fit?
Yeah, probably could do better. Probably not as an avid runner as you are, but I think just at least 30 minutes of some form of activity, weightlifting, running, is very helpful, just to clear your mind I think decompress. So that's pretty much just 30 minutes of either running or weightlifting. I think is very helpful a day.
And how do you balance the family and the work? Both can be demanding sometimes. How do you? And you have very supportive families, you say, but how do you balance all that?
So right now, I don't think there's a balance. It's work. It's been busy, but I also, one thing that I've realized is, you don't get many opportunities in life, and you have to take advantage of them. And I think for me, this, has been a really good situation, and with all the opportunities being presented to me. So, I want to make sure that I take advantage of them early on. And I think that work-life balance, it's maybe a little bit shifted more towards work, but I think, I think as I progress through my career, I think that's going to get better, and I think it's just a matter of me shifting my priorities a little bit, yeah, when the time is right, and I think for now, my priority is work and taking advantage of all the opportunities I have. So.
Wonderful. And then how many hours do you sleep?
I average 4 to 6 hours a night. Depends.
Wow,
Yeah.
that's amazing.
Yeah. Uh,
That's
been able to do okay so far.
No, and you're happy. Looks you're functioning. I think there's a small percentage of people that can survive on this number of hours, and I guess you are one of them. So
Yeah, yeah.
congratulations.
Oh, thank you. uh,
Now, how about a favorite book or a favorite movie that you have?
yeah. So favorite movie all time, I would say would be Gladiator, the first one. Um, and I think most of my reading is like nonfiction, and I guess if a non-medical, would be obviously if it's medical, it's the manual of CTOPCI,
Oh,
uh,
uh
but it's a Daily Stoic by Ryan Holiday. I think it's a great book to and really some narratives from really good um you have Marcus Aurelius and some of the good writers from back in the day. I mean, really, really good teachings, and keeps you, some of the lessons really keep you grounded and help you in your, everyday, day to day practice. So, yeah.
Wonderful. How about the movie?
Yeah,
Oh, you said Gladiator,
it was the
Gladiator. Sorry,
Gladiator. Yeah,
sorry,
yeah,
sorry, sorry.
yeah.
And then, how about you said you walk, you spend time with family. Do you have any other hobbies or any other activities in the very little time that's left between the cath lab and the
Yeah.
rest?
Yeah, I love to play tennis, and I was played tennis since high school, and it's really whenever I have time to get out there, it's great to enjoy that, and I think I'm trying to get into golf, taking some lessons. It seems like the thing that interventional cardiologists do, so I think.
Yeah,
uh,
better than flying. That's for
Yeah,
sure.
yes. Oh yeah. Not a good track record, yes, with flying. So
uh,
yeah.
okay, sounds great. And then, what are the things that you are the most proud of so far?
Um that's a great question. So I think for me it has to be, to make I immigrated here when I was 11 from India. And my parents, my whole family moved here, and mostly for education and the opportunities. And I think I'm proud of the fact that I've taken advantage of all the opportunities that I've been presented, and the fact that my parents, I'm sure, are proud of where I'm at in my stage of life, and I think for them, with all their sacrifices, I think for me to be able to take advantage of those, and so I'm really proud of that.
Yeah, no, congrats. And also it's tough to adjust to a new place. Where in India were you before?
So I was in western part of India called Gujarat.
Wonderful.
Yeah, yeah, and the city was Ahmedabad.
Wonderful. Do you still visit a lot? Do you have family there? And
Most of my family's here. I was just there. So I got married a couple months ago, and so we got married in India. So we all went, had a great time, and I had some of my colleagues from here join. Bill, Wassam, Adam, Krima. They all had a great time, and so yeah, I've been back maybe once, twice since I moved here. About 25 years ago.
it must have been a 1 week wedding, or
It
was it shorter
was.
than that?
Yeah, yeah. It was about 3 days worth of events. It was good. It
Oh
was a
my
lot of fun.
goodness. Well, congratulations, congratulations. That's been lots of milestones there, and sounds wonderful.
Yeah, absolutely. Thank you so much. Yeah, it was great.
And then, what are you looking forward in the future? What excites you the most right now?
I think from a professional standpoint, just the amount of innovation in this field, and I've seen a progression from my first year till now in terms of my skill set, being able to developing and growing that, and being able to tackle some of the most complex cases, and I hope to get to Bill Nicholson's level one day, and that's where I'm working towards, and hopefully. We'll keep working, and doing as many cases as I can to get there. Yeah.
Wonderful. So, Pratik, any pieces of advice you would have to people who, want to learn or want to become complex operators and get good at it? What are the top things you would advise them to do?
Yeah. So I think nowadays with dedicated, there's so many dedicated fellowships for CTO PCS. So if that's an option, I think that would be great. If that's not an option, I think our community is so nice in terms of availability for proctors, or just going to other labs to watch and learn and do cases. um, a lot of the live conferences are really really nice. You get exposure to a wide variety of cases. And so I think it would be, try, if you can do a fellowship, that's great. If not, find proctors and go visit labs. And I think it uh, everyone, I know you, Bill, Lombardi, Tony, Jay Cotry, all of these guys, they're happy to give their cell phones, and you can call people any time of the day. They answer and are available to help. So I think the resources are there, and I think you just have to take advantage of the opportunities. And one way to do that also is industry. Our industry colleagues are very helpful in making those connections and finding proctors and other mentors at institutions. If you don't have someone within your institution that is able to help, so I think a lot of different avenues.
Perfect. I think you're right. The network and interacting with people who are good at this, like everything else, I guess, in life, can really help you
Yeah,
get better.
absolutely.
Wonderful. Well, Pratik, thank you so much. It was wonderful to hear from you. Congratulations on building a great presence at Emory and internationally. Very excited to new devices and your cases coming up.
Thank you so much, Mono. It's a pleasure to be here, and I really appreciate the opportunity. Thank you.
Thank you for listening to the Sensei podcast.